Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery. Today I'm going to be performing a primary breast augmentation using the new Motiva implants. Our patient is a young 25-year-old female who wants a moderate increase in her volume and to improve her shape. She's really looking for more projection and a balance to her breast, but she wants a gentle look. I'm choosing the Motiva implants for her because when we tried them on, it gave her just a softer look that she really liked more than the other brands. The reason I like the Motiva implants, it's the newest in technology. They're cohesive gel, just like the other three brands. However, this company is able to fuse the gel to the shell. So when you hold the implant on its side, there is no rippling, and the projection of the implant is at the center point where the other implants, the gel kind of falls to the bottom, so the most projection of the implant is on the lower third, and I think that makes a difference. So that's why we're choosing that today. You'll be using an inframammary fold incision to have access for the implants. I always use the inframammary fold. So once I make that incision through the skin and the soft tissue, I create a pocket under the muscle. I will use sizers in that same range, and that allows me to really check to make sure that the sizing that we did in the office would be accurate. There's always a little bit of breast asymmetry, not only in the tissue, but also in the rib cage. And sometimes you have to overcome that in the operating room. So when you size in the office, you may not be able to account for that. So this way I can fine tune it. So once I create the pocket on one side and put in the sizing implant, I will go and do the same procedure on the other side. Always check again, making sure I have good hemostasis, there's no bleeding in the pocket. And then for preparation of putting the implant in, once the implant is opened on the back table, I irrigate it with betadine, I irrigate the pockets with betadine, and I re-prep the skin with betadine. The implants are then placed in the pocket under the muscle, and I close it with several layers of sutures after that. Breast augmentations usually take about an hour for me from start to finish. Might be a little bit longer if I have to do a mastopexy or a breast lift. But in this case, it would take about an hour. She'll spend about an hour to an hour and a half in the recovery room, and then she goes home. Most of my patients, because the implants are under the muscle, will feel more pressure than pain. This is not a very painful operation, but they'll feel pressure on their chest, and I usually treat that with some medication, and that helps them for the first 2 to 3 days feel pretty comfortable. So for the most time, patients go through this operation without any issues at all. The hardest part is I don't let them exercise for 3 weeks, but they're usually back to work within the week. Their first post-op visit is usually several days after surgery. There's usually some mild swelling at that time. That swelling usually goes down in about 3 to 4 weeks. And then after about the 6 to 8 week mark, the tissue really softens around the implant. And by usually 4 or 5 months after surgery, the patient forgets that she even has implants.